There's feedback from patients and the community saying, hey, we really don't want to just jump to medications and surgical interventions. But providers are saying, hey, we really don't know how to educate people. Okay, what do we say?
We only know how to give people a prescription.
Exactly. I only have this much time to see my patients. Okay, and that's a whole other issue, right? Because of reimbursement and the push to see volumes of people. And then there's also, you have this stress on outcomes, right? So providers are measured as a population on how they treat their patients. So how many of your patients have their blood pressures controlled? Okay, how many of your patients have their cholesterol levels controlled? How many of your patients have their hemoglobin A1Cs or their blood glucose levels controlled? They're actually measured and watched. You get scorecards on that. As your population, Mr. Jones, how many people you see have levels that are actually in normal value. So you have to answer for that. So if it's not, then what are you doing about that? Okay. So although we want to give our patients time to work on lifestyle, okay, you got these quarterly scorecards coming out saying, okay, well, your cholesterol patients, they're still not to goal. Okay, what are you doing about that? Okay.
And this is so interesting because it sounds like what you're saying is like a person like me.
Mm-hmm.
They say that my cholesterol is high. I go, and it's interesting how, and I'm thinking of this as we're having this discussion right now. So then I said, okay, well, I'm not taking that medication, and I'm going to do some things. So then the doctor or the practitioner said, the primary care physician said, okay, you can go to this website and read this, this, or this. And I'm really thinking about this as I'm talking to you. For one, I had done that before when it first started to creep up. Uh, but then, as I listen to you, I'm thinking that should have been incorporated in the meeting because I had done the test. We scheduled the follow-up appointment, and so that should have been incorporated in the follow-up appointment that, okay, the first thing I would recommend is I went to this website, the USDA or the FDA or whoever it is, and they have, the paleo or they have the Mediterranean, and it means this, and these are some options. And if you don't want to do those, we can give you a pill right now. And so it's like, but she left it to me to go and do the research. But now you're saying, and if I do that research, if I do the research, implement that, then she gets credit for my cholesterol going down. When she really,
she counseled you on it, right?
Oh, okay. So, is that what it was?
Right.
Okay.
Yeah. I mean, it's kind of it's a benefit for both, right?
Yes.
Ultimately, as providers, we really do want the best for you.
Mm-hmm.
So how you get there, obviously, is going to be individual. But yeah, she would,
That's okay. That's okay. It's just that understanding what's going on there because to me it's like I said, I'm not gonna keep beating this up, but it's interesting how they want to say appeal for something versus do these other things. And during the meeting, they're not prepared to talk about other things. They're just prepared to talk about the pill. And then doing other things is almost like you said in school. It's almost like the last 30 seconds of the appointment.
Oh, you should lose weight. Oh, you should start dieting, or you should exercise.
And you said 40. Oh, you said 40. Oh, how about 30?
Right.
Everything that happens, you're old and you're overweight. It's like wow. Okay, wait. You had to have learned way more than that in medical school.
Right.
It's like
well, and we're finally starting to make the shift now that there is such a spotlight on weight loss with the different medication options that's out there. So providers and hospital systems and organizations and programs are realizing, we probably need to do a better job with this, and that we need to approach it from a team-based approach. The reality is your doctor really doesn't have all of the time, but does it have to be from your doctor? You should probably see a dietitian. You should probably see a physical therapist. an exercise physiologist. There's other people in the team that can support in the plan and educating and counseling and coaching you. It doesn't have to come, from your clinician. So that's what I think is probably the best of both worlds. Maybe the physician or the provider have that conversation with you to kind of like open the door, but you have the other team members that support it. So
Okay.
yeah.
Good morning. Again, you're listening to the Black Entropy Radio Show, and we're talking Health Monday with our guest, nurse practitioner, Latonia Ford. And one thing I like to do on Black Entropy, since we're trying to, provide knowledge, resources, information, and inspiration to people, is I bring on people with basically who are experts in a particular industry or profession. And so you just said a couple of things that I want you to break down. That physiology and dietitian.
Okay.
So what does that mean, right?
Right.
So if I should be going there and asking for a what? A
Right.
physiologist? So again, when you're meeting and a doctor says that your blood pressure is high or diabetes or high cholesterol, if these are three big issues,
Yeah.
what before I even get to the follow-up appointment so I can be prepared with the doctor to talk about these things, because I think it sounds like that's something that's really important that patients should be doing, is preparing so that you understand these other methods that are available and options to you.
Yeah, other options and again, other team members. So a registered dietitian, they're licensed actually just as nurses are and physicians, all in the area of nutrition. And they may even have expertise in different health conditions. So they could be, specializing in diabetes or high blood pressure or cancer or athletes. It just kind of depends on sports medicine, what your goal is. So I like to look at dietitians as they help you understand the foundations of food. A lot of us don't even understand how our body uses food. What does your body do when you eat a piece of chicken? What does your body do when you eat a piece of bread? All of those processes that it goes through. So dietitians help you in understanding the basic foundations of putting a balanced meal together. So even if you think you understand, I tell everybody you should still sit down with a dietitian. Okay. You can always get something out of it. I talk to dietitians.
Yes.
It amazes me how much information they can, share with you. Exercise physiologists are, they specialize in physical activity and exercise plans that are specific to health conditions, okay? And health conditions that could really limit your physical abilities. Like I think about those with like heart failure. Okay, where you may not necessarily be able to go into a gym safely if you have heart failure, but an exercise physiologist can help you come up with a physical activity plan that fits within your, physical limitations and needs. A physical therapist, typically they help with rehab, rehabilitation, regaining strength and health, things like that. But they can also help you come up with exercise plans too. So I would kind of be open to that as well. And I don't expect people to go into their doctor's office and say, hey, can I get a prescription for an exercise physiologist? I would expect maybe, can I see a dietitian? Do you think I should see a physical therapist? I think the average person would do okay with some sort of basic exercise plan. And, a dietitian. So.
Now, and then the other part of that, if you can talk about, so again, when you say I have high cholesterol, I have high blood pressure, what are the things that I can buy over the counter at a local pharmacy that can help me monitor this so that when I go in, so like for me, I think it's interesting that my blood pressure seems to be one thing when I go into the doctor.
Absolutely.
And then when I take it at home, it's only 120/80. And so, but what I'm really asking you to talk about is the fact that I even take it at home, that I have something.
Yeah, you bring up an excellent point with that. I look at a blood pressure monitor like I look at a weight scale. It's just a piece of equipment you should absolutely have in your house. Okay, it provides you with more information and maybe even better information outside of the office, because you're right. You can walk in the office, in the doctor's office, and your blood pressure is high. We call that white coat syndrome. There's the anxiety, there's the getting there, I had to find parking, where's my insurance card, and you finally sit down and check your blood pressure and it's high. Well, it's not really high.
Yeah.
It was all of the rigmarole, getting into the office. Like you said, when I'm at home, it's normal. We really like that information. We like that information a lot. So it helps if you have your own blood pressure monitor at home. That's one piece of equipment for sure you should have. You should also have a scale. A lot of people, we're here to lose weight, but when was the last time you got on the scale?